If you're suffering with sciatica pain right now, chances are good that you've looked for stretches or exercises that you can do that are safe to decrease your sciatica pain. This is what we're going to talk about right now. There are a lot of different stretches and ideas of what to do with sciatica pain. So today we're going to present ones that are research-backed, and I'm going to explain how you should feel while you're doing them, as well as why you want to be doing these particular exercises. It's important for you to understand exactly why you're doing what you're doing in order to get the results that you're looking for. So in today's video, we're going to present our top 5 exercises and stretches that we recommend everyone do who is suffering with sciatica. These exercises and stretches are going to feel very simple and obviously should be pain-free at all times. You can do them regularly throughout the day to help manage your symptoms, and you can do increased reps over time as you feel more comfortable with these exercises. Ready? Let's go. The first thing I'm going to have you do is some deep breathing. Now, there's a lot of reasons why we want to do deep breathing. The first of which is to decrease stress and tension in our body. When you do the deep diaphragmatic breathing, you're going to activate the vagus nerve, which is your chill out nerve and your feel good nerve. And I guarantee you, if you're suffering sciatica pain, your body is in fight or flight mode. So it's going to help to get it out of that mode. Now, it won't necessarily decrease your pain, but it should certainly make you feel better. Now, I'm going to link a video here where we're going to discuss it more in detail. But the basic point of deep breathing is making sure that you're getting the diaphragm moving, or that deep belly breathing. Some people call it a meditation breathing, and making sure that you're decreasing tension through your neck. To do this, you want to be taking a deep breath in through your nose, making that belly bubble, and then blowing out like you're blowing out a birthday candle. And even allowing for a little bit of an abdominal contraction there. Now, when you're doing this, you don't want to have any motion through your pelvis. There's no rocking going on while we're doing this. This can actually increase the pressure to the sciatic nerve. Now, with the deep breathing, I usually have people do that for 10 to 15 reps just to make sure that everything starts working correctly, and usually it should leave you feeling a little bit calmer and a little bit less stressed. Now, the next stretch is going to seem a little bit controversial, but if you've watched any of my videos, you know that I do not like stretching the sciatic nerve. I don't like stretching the sciatic nerve because the sciatic nerve does not like to be stretched. But what I do like to stretch is actually the psoas, or the hip flexor. Now, this may seem weird to you, but what you need to realize is that the psoas actually originates on the lumbar spine. You see, on the lumbar vertebrae, there are these little arms that stick out to the side. They're called the transverse process. And the psoas actually starts from the front of those. So when you start having low back pain, and the muscles contract in the low back, the psoas will also contract, which puts pressure on the discs, nerves, and joints. So stretching the psoas is a safe way to actually be able to stretch your low back without injuring the sciatic nerve. Now, there's lots of ways to stretch the psoas, but it can potentially cause issue with your low back. So what I like to do is a very simple stretch. You can do it usually on your couch or your bed if it's low enough. It is important that your foot remains on the floor while you're doing this stretch. You're just going to have one leg hanging off of the side and making sure that you're getting that stretch through the front. So in this case, it's my left hip. My right knee is just going to be bent up with my foot here to stabilize, so I feel more safe and comfortable. If you're doing it on the edge of your bed and you feel like, ooh, I feel a little unsteady, push your shoulders over to the side a little bit more, and that's fine. It doesn't affect the stretch in the hip, but will help to improve your stability so you don't feel like you're about to fall off the couch or the bed or whatever you're using. Now, it's important to have that foot on the floor and make sure it's stabilized, but if you feel like you don't get enough of a stretch, what you can do is just sneak that foot back so that knee drops down further, so then you're able to get more of that stretch through the front of your hip. Remember, the hip flexor, the psoas, is right here on that front of your hip, and that's where you should be feeling the stretch. Obviously, if it's bothering your sciatic nerve, don't do it. All right. The next exercise is my absolute favorite for sciatica, or really any low back pain issue, because it causes you to do some rotation. which is very healing to the joints, the discs, and the nerves. I call it supine caudal rotation because you're going to be laying on your back, you're going to be rotating your knees from side to side, which will allow you to get a little bit of activation in your abdominals. And what we know is when we activate the abdominals, it helps to activate the small muscles or the multifidi in the low back. This will help to improve control of your low back and probably make other exercises and stretches more possible for you. So to do this one, you're going to be laying on your back with your knees bent up. You want to be somewhere where you feel stable. So either a table, it may be your bed if you have a firm mattress, but if it's too cushy and you feel like you can't have good stability, go ahead and do it on the floor. You're going to start with your knees going to one side, and as soon as that hip comes up off the table, you're going to use the muscles in the front here, those abdominals, to push it back down and bring those knees back. So knees go to the side, hip comes up, hip comes down, knees come back. Now we only do one side at a time, even though we do want to do both sides, because we want to make sure that we're focusing on the right muscles. So once you've done 20 on one side, you're going to go to the other side. So knees will come to the right this time, left hip comes up, use the abdominals here to push that left hip down and bring those knees back. Now, as you can see, this is a very small motion. It may even be difficult to see in this video because it is so small. You just want to let those knees come to the side until that hip starts to come up. It's more of a sense of the hip coming off the table as opposed to letting it come over here. Obviously, when I come all the way over here, my hip is really far up. It creates that long lever arm. Now I'm going to have to use a lot more muscles to bring that back. Now, it's very important, small motion. More is not better. You want to let the knees come to the side, hip comes up, hip comes down, knees come back. And again, I like to do 20 to each side if you can tolerate it. If you feel like right now your sciatica is so flared up that you can only tolerate 5 to 10 reps, then start there. Make sure that you feel comfortable with what you're doing and it's not increasing your symptoms. Okay, so now we've got those muscles activated. We got a little bit more control in our lumbar spine. Now we're going to do a little bit of rocking to really get those muscles to start working together. How much motion you do with this is dependent on how you feel. Again, none of these exercises should ever be painful. So listen to your body. If there's only a certain range of motion that you can tolerate right now pain-free, then I want you to stay in that motion. I'll show you the beginning rocking motion and how you can progress it, but I really need you to find that space that works for you to make sure that you don't have increased symptoms before you do it, while you're doing it, or after you do it. So you're going to start on your hands and knees. You want to make sure that your hands are underneath your shoulders and your knees are underneath your hips. Now what you're going to do is start with a gentle rocking back and forth because you just want to see how your body feels with this. Sometimes when your sciatica is really, really flared up, this can actually become an aggravating exercise. In that case, I want you to stop as soon as you start because we're not trying to activate anything. Now, as you start to feel better in this, it gets a lot of muscle activation, but it's more the smaller muscles. So those stabilizers get activated, which is really important when we're suffering with sciatica. So as you start to feel better, you may feel like you can increase that motion. If you can, go ahead and go as far as you feel comfortable with, but if you start to have any symptoms, I need you to back off and stay in that pain-free range. The goal is to eventually get all the way down so your heels are resting on your buttocks, assuming that you have that range of motion through your knees, and then coming all the way back up. Now, I don't like staying in this position when you have an acute sciatica or a recent onset of sciatica for a long period of time. So the goal is really just to keep that rocking back and forth to get those stabilizers activated to help support your low back and decrease your sciatica symptoms. Now, if you've watched this channel for a while, you know that I don't like doing any low back exercises when you have especially an acute sciatica or a recent onset of sciatica. But what I do like doing is glute squeezes because our glutes tend to just turn off whenever sciatica erupts. So we want to make sure we're getting that good glute squeeze. Now, I differentiate from many people who are on YouTube who recommend glute squeezes that cause a pelvic tilt. I don't like causing that pelvic tilt because that puts increased pressure on the sciatic nerve. So you may be saying, Dr. Amy, I've already tried glute squeezes and they actually made things worse. I'm going to encourage you to try glute squeezes in a different way. Glute squeezes that don't cause a pelvic tilt. Let me show you what I mean. Often when people do glute squeezes, they think I'm going to squeeze my glutes and it's going to cause a lifting here. Now that may work in the long term when you have more of a chronic sciatica, but what I want you to start with is just squeezing your glutes together. There will have to be a little bit of a motion change in that pelvic tilt, but not allowing it to tilt all the way up. All right, what I want you to do is just squeeze those glutes together and minimize the motion through your pelvis. Now, for some people, this is actually difficult to do lying supine because they feel like I really want to get that pelvic motion. If that's a problem for you, I'm going to have you do it in sitting. It's way easier actually to do it in sitting and not allow that pelvic motion because you can really squeeze those glutes together and then relax. And it's more difficult to allow that pelvis to move in that sitting position. So you can see as I squeeze those glutes together, you can see how I kind of lift up and then I relax. It gets a really good glute contraction. It's actually kind of hard to hold it and doesn't cause any rotation through the pelvis. So you can do that glute squeeze, hold it for 5 seconds initially, and then relax. You want to start with 10 of those. You want to work up to a 10, 20, or even 30-second hold. And you know, it seems like it's not going to be that hard, but it is actually really challenging. And sitting is my favorite position to start it in because it's actually the most challenging position. Now you can do it, like I said, laying on your back. You can even do it in standing. Just make sure that you're not getting too much rotation through your pelvis and aggravating your sciatic nerve. All right, there it is, the top things that you can do for your sciatica, especially if it's an acute, hot, flared up sciatica. These exercises should not increase your symptoms. So if they do, then I want you to stop doing them because the point is that you're not aggravating your symptoms, you're calming things down. Now, I definitely recommend you check out some of our other playlists for other things that you can be doing to help calm your sciatica down. And it'll also show you some exercises that are safer to be doing as your sciatica symptoms progress.